So far, I have explained dangerous vertigo and central vertigo. Next, I would like to mention vertebrobasilar insufficiency, which is one of the most common central vertigo. If there is circulatory insufficiency in the vertebrobasilar artery system, blood flow to the semicircular canal via the inner ear artery will be impaired. So some persons seem to misunderstand that vertebrobasilar insufficiency is peripheral or inner ear vertigo. Rather, it is the central vestibular system, such as the cerebellum and brainstem, that is vulnerable to poor circulation and lack of oxygen, not the inner ear. This fact has already been proven by then Professor Takashi Matsunaga of Nara Medical University. In other words, if blood circulation becomes inadequate, the brain, that is central nervous system, will fall into functional decline before the inner ear. For this reason, again, vertebrobasilar insufficiency is not inner ear vertigo but central vertigo. As for the locations that cause vertigo, as mentioned in the beginning of this series, the same kind of vertigo can occur not only in the inner ear, but also in the cerebellum and brainstem. I would appreciate it if you would reconfirm this fact. HVBI, or hemodynamic type of vertebrobasilar insufficiency, is often seen in daily practice, and is simply called poor circulation. Not a few doctors and medical institutions think that, when there is no brain problem on the CT or MRI images, then it is probably just vertigo, but this is not true. Poor blood circulation is only a functional lesion. Therefore, unlike organic lesions such as infarction, hemorrhage, tumor, etc., which are obvious to anyone, the current MRI usually does not show any abnormality. Furthermore, for small infarcts of less than 1 cm in the cerebellum or brainstem, the current MRI DWI, diffusion-weighted imaging, a method to detect fresh infarcts, may not be able to detect them at a high rate. As a matter of fact, it is difficult to visualize even fresh cerebral infarctions with CT. This patient was a medical doctor who came to the hospital complaining of vertigo. He was a 79-year-old male, being treated for hypertension. He had been looking up and cutting tree branches the day before. This means that his neck was in hyperextension. This posture, as I will explain later, is dangerous for the elderly because it causes the neck to tighten and the arteries to become compressed, which can cause dangerous vertigo. Vertigo does not always happen at that time. The next morning, the patient developed vertigo and vomited. The nystagmus findings on arrival showed a fixed directional nystagmus that at a glance looked like vestibular neuritis. When I palpated his neck and shoulders, they were stiff as if they were steel plates. In clinical practice, this palpation becomes an important key to the diagnosis of vertigo and headache. A patient with vertigo told me, "When I visited a large hospital or university hospital, the doctors were looking at the computer screen and never touched my neck and shoulders." Isn't palpation one of the basic clinical skills? Cervical spine X-ray showed a very strong deformity, which was thought to be the main cause of the stiff neck and shoulders. Cervical MRA showed marked flexion of the left vertebral artery due to arteriosclerosis, red arrow in the figure on the next slide, and mild tortuosity. This finding indicates subtle difference in blood flow velocity between the left and right vertebral arteries. When that happens, subtle turbulence occurs after the left and right vertebral arteries join the basilar artery in the skull. Then poor blood circulation occurs subtly in the brainstem, but it does not lead to vertigo up to this point. However, the patient had been turning his head upward, or hyperextending his neck for 1 to 2 hours in addition to the usual stiff neck and shoulders. When the neck arteries were compressed by branch cutting, the potential for poor circulation in the brainstem became even stronger than before. In this way, it was concluded that the ischemia in the brainstem became temporarily stronger and caused his vertigo. The diagnosis was vertebrobasilar insufficiency, HV-B-I. Please do not assume that the vertigo is caused by the ears without interviewing and palpating the patient about the strong stiffness in the neck and shoulders. By the way, in this case, The vertigo disappeared in a several-day period with anti-vertigo medication and cerebral circulation improving medication. Here is why it is dangerous to hyperextend the neck. A typical disease is the beauty parlor stroke syndrome. This has already been broadcasted on TV, so some of you may know about it. However, some beauty salons still hyperextend the neck as shown in the illustration when washing hair. 5 cases of this disease were published in the United States in 1993. The patients developed strokes, especially in the vertebrobasilar artery area, during or after washing their hair or leaving the hair salon, and 3 cases were accompanied by vertigo. It was also reported that cervical spine deformity, narrower vertebral artery on one side compared to the contralateral side, and elderly people with age-related arteriosclerosis were important to pay attention. In addition, Kenji Endo, a lecturer in the Department of Orthopedics at Tokyo Medical University, announced that a posture in which the neck is bent backward is also related to pinching and stenosis of the vertebral artery between the first cervical vertebra and the skull just before it enters the skull. In my opinion, especially in the elderly, there is more or less arteriosclerosis, which causes metering and tortuosity of the vertebral artery. Furthermore, when the neck is hyperextended, that is, back bend of the neck, in addition to the usual tension in the neck muscles due to stiff neck and shoulders, the vertebral artery is compressed by the tense neck muscles. When that happens, the sympathetic plexus around the vertebral artery is stimulated, causing contraction of the vertebral artery, which can lead to vertigo in mild cases and stroke in some cases. Besides, there are cases where the stroke occurs not only while washing hair, but also immediately after leaving the hair salon, or even later. In recent years, there has been an increase in the number of young people with straight necks, and in more advanced cervical kyphosis, cervical lordosis is normal, due to the slouching posture caused by smartphones, computers and tablets, or hunchbacks. When the cervical spine is in this state, strong neck and shoulder stiffness can cause vertigo that is similar to that from the ears. I hope you will pay attention to the neck, which is also the pathway of the autonomic nervous system. The patient was 28 years old, female. She complained of lightheadedness and feeling of wobbling. She had an office job and operated a computer in a slouching posture all day long. On palpation, there was muscle tension and tenderness in the neck and interscapular region, so the neck and shoulders were stiff like a board. Nystagmus showed leftward fixed directional horizontal nystagmus. The cervical spine X-ray showed kyphosis as shown in the figure. The curve is completely opposite to normal cervical lordosis. With kyphosis, the neck and shoulders are very stiff. She had no ear symptoms, and in this case, the diagnosis would be the vertebrobasilar insufficiency, but it could also be diagnosed as neck and shoulder-related vertigo or cervical vertigo. Because this patient had tenderness in the neck and interscapular area. Therefore, each diagnosis is almost the same thing after all. In short, stiff neck and shoulders can easily cause poor blood circulation in the vertebrobasilar artery, leading to vertigo similar to that caused by the inner ear. In general, young people who complain of vertigo do not often have their cervical spine X-ray. There is a comment from a U.S. otolaryngologist that even in the U.S., there are only a limited number of doctors and medical facilities that can diagnose the relationship between neck and vertigo. This is the same situation in Japan. In the current situation, it is quite possible that patients like this case can be easily diagnosed as vestibular neuritis, or the cause is considered to be unknown. Therefore, palpation of the interscapular region and neck, and patient interview are also important. Again, recently there has been a rapid increase in the number of people operating computers, smartphones, tablets, etc., and straight neck, kyphosis, etc., have become a not uncommon situation even among young people due to poor posture. Some patients have cervical spines that are slightly tilted to the right or left when viewed on a frontal X-ray. This can also be a cause of stiff neck and shoulders. The times are changing rapidly. In the United States, orthopedic doctors have already published a paper as text neck in 2017. Then why do the abnormalities in the cervical spine cause vertigo? I have experienced a young patient whose cervical spine had started to deform due to intense sports. He was a third-degree judo player in his early 20s. When there is deformity of the cervical spine, which is common in middle-aged and elderly people, or when there is straight neck or kyphosis of the cervical spine as mentioned above, stiffness in the neck and shoulders becomes stronger in daily life. In this situation, the tense cervical muscles put pressure on the arteries, and the sympathetic plexus around the vertebral arteries becomes hypersensitive to even subtle stimulus. Under this condition, hyperextension or hyperflexion of the neck or turning the neck in circles can easily excite the sympathetic plexus around the vertebral artery, causing the vertebral artery to constrict, resulting in poor blood circulation and leading to vertigo. In other words, the vertebral artery runs through the cervical spine towards the brain, and is therefore inevitably susceptible to the cervical spine and neck muscles. For this reason, stiffness of the neck and shoulders caused by poor posture such as cervical spine abnormalities, hunched back, and rolled shoulders, can be an important factor in the development of vertigo. How to suspect vertebrobasilar insufficiency, namely poor circulation in the vertebrobasilar artery area, HVBI. This means that you need to know what symptoms you usually have to suspect this disease. The followings are some of the symptoms that suggest this. 1. Feeling of head being pulled back. Heavy feeling at the back of the head. 2. Numbness in the ends of the extremities, also called glove and sock-type numbness in the hands and toes. 3. Double vision, foggy vision. 4. Short loss of consciousness, also called syncope, or pre-syncope 1 step before syncope. 5. Bilateral tinnitus, may have time lag on each side, bilateral ear blockage. These symptoms are caused by poor blood circulation in the bilateral inner ear arteries. 6. Decrease of blood pressure that occurs on hyperextension or hyperflexion of the neck. This suggests a loss of function of the blood pressure control center in the brainstem. I have described concrete cases of vertebrobasilar insufficiency in this section. In the next section, I would like to mention clinical cases of central paroxysmal positional vertigo.